Can you please state your name and position here at Colon Cancer Prevention Project?
I am Lindy Reinhardt, and I am the Community Outreach and Survivor Support Manager.
What does your organization do, and who do you primarily help?
We do a lot of different things throughout the state of Kentucky and in southern Indiana. We serve the population at large to try and raise awareness about colon cancer and the preventable aspect of the disease, and make sure people are engaging in conversations with doctors and family to make sure that they're getting screened and preventing themselves from enduring the diagnosis of colon cancer like so many of our citizens unfortunately do. We've seen great progress, and we continue on a lot of our efforts to make sure that the population is aware of what we're trying to help them understand.
What services do you provide?
We provide one direct service program, and outside of that, it's mostly services where we're engaging with different community health centers and other health professionals throughout our state to make sure that we have strategic partnerships to help make patients and their employees and their families make healthy life decisions, specifically about colon cancer. The one direct service program that we do offer is our Fighters Fund program. It was a program that was started last year in 2013, and it is a grant program that patients can apply for as long as they live in one of the two counties in southern Indiana, Clark or Floyd, or anywhere in the state of Kentucky, as long as they've been diagnosed with colon or rectal cancer and they're undergoing treatment. They can apply for this grant that allows them to literally receive a check for $200 with no questions asked what they're going to use it for, anything that will lessen their burden. The financial burden is one we can help with more than some of the other burdens that are so difficult and plague not only the person but the family. So Fighters Fund program is a great program. We've had over 50 recipients in the first several quarters of that program, and we are doing different efforts to make sure that throughout the state people are aware of that program, not just here in Louisville or Lexington or some of the bigger cities, but in the areas where the need is greatest. So that financial piece is one direct service, but outside of that, it's a lot more of the education, awareness, and all with the big goal in mind of 80% screening by 2018.
What's the most difficult part of your job?
I think the most difficult part for me specifically, and then I can also speak for the organization, but for me specifically, it's I'm one of 3 staff people here full time, and we have a big need in our whole state to change the situation with colon cancer. We were founded as an organization in 2004, and Kentucky at that time was 49th worst for colon cancer incidence and mortality, and screening rates were really low. You can imagine being second to worst. There was a lot of room to grow to even move up a little bit, and we're really proud. We recently celebrated our 10th anniversary, and we are now, as a state, 20th for screening, and we've seen decreases in incidence and mortality. So, but I think, that long story short is that, we have 3 staff people that are doing the work that is huge, and the workload is great. We're all very passionate about it. We've all unfortunately lost a parent, but I think the biggest challenge is we need more volunteers and more people that are helping, us continue on that momentum to where we can one day be first, and go from the bottom to the top. So, but as an organization,